So we are broadcasting and we should be live. Just a moment to confirm that we are great. We've got plenty of folks joining us, which is fantastic. Good morning, everyone. If you're here for a fantastic conversation around the intersection of COVID-19, the HIV epidemic, LGBTQ marginalization with this wonderful group, then you're in the right place. We will give folks just another minute or so to get started, and then we will be ready to go. All right, well, thank you again for joining us. My name is Tyler Huff and I work on the development team at Chicago House. And before we get started, just want to offer a couple housekeeping items. Today's conversation is being recorded and streamed live through our Facebook page. And then the recording will be sent out later this afternoon. And then from there, please feel free to use the Q&A box for any questions, or you can send them directly to Chicago House. We'll be taking a few audience questions throughout today's discussion. And then we'll also be live tweeting today's event, and hope you'll be able to join in the conversation by tagging us at Chicago House 85, as well as many of our other great partners. If you have additional questions, you can feel free to tweet those, share them on Facebook. But with that, Kim, I will go ahead and turn it over to you.
Thank you, Tyler. My name is Kim Hunt. I am the Executive Director of Pride Action Take, which is a project of the AIDS Foundation of Chicago, where I also serve as the Senior Director of Operations in the Policy and Advocacy Department. And I am thrilled to be here today. I want to thank Chicago House for putting this amazing panel of rock stars together, and for just having this conversation. A lot of times when we're deep in the work, it's hard to look up and be reflective and think about how we carry the things that we are doing into the next phase of whatever our new normal is going to be. So I'm really looking forward to this conversation with our panelists today. And I'll just do super brief introductions, and then we're going to jump right into conversation. So first on the panel, and we're doing this in alphabetical order, not in any other order, because they are all equally great. And let me also warn folks, I live across the street from a fire station, so you may hear noises. I'll go on mute as much as makes sense and try to power through. We're all at home, so stuff is happening. So I just want to point that out. So first we have Aisha Davis, who is the Director of Policy at the AIDS Foundation of Chicago. Aisha, you want to wave? Then we have Michael Herman, CEO of Chicago House. Okay. Channyn Lynne Parker, Director of Strategic Partnerships at Howard Brown Health. And then last but not least, LaSaia Wade, founder and executive director of Brave Space Alliance. So thank you all so much for being here today. And in the background, of course, you will hear from time to time, is our good friend, Tyler. So I'm gonna jump right in to ask the questions. And this is for everyone. And let's just go in the order that we did the introductions. So it'll be Aisha, Michael, Channyn, and then LaSaia. So let's start with the personal. And if each of you just take a couple minutes to tell us what you've been doing to take care of yourself since we've been sheltering in place.
Sure. One thing that I've been doing is making sure that since my work is really related to policy all the time, and that a lot of the policies that we're seeing coming out lately are related to the pandemic, I've limited my intake of information around the pandemic. So I have my focus on what's going on, the news, current events, and then I turn it off. That's just been a very purposeful, intentional thing that I've been doing. When I'm done for the day, I'm done. I close the laptop, I turn the news off, turn the notifications off, and it's just me and my space. Another thing that I've been doing is actually making my space feel more fun and like exciting to be in, because I'm in the house and I'm gonna be in the house for a minute. So all of those little home improvement things that I've been talking about doing or making note of and like pushing out are all happening now. So I've been hanging more art on the walls. I've been tending to more plant care things, trying to, you know, become more of a plant person. My aloe is surviving and looking very beautiful right now. So those are the two big things that I've been doing.
I think for me, looking both emotionally and physically, big points for me working from home. Physically, I actually love working out with other people. So it's been a bit of a challenge, but I do mostly Orange Theory. So they have a lot of online videos, which is interesting, but it seems to work. So push myself to try to do that once or twice a week. And emotionally, I'm finding people keep me positive, and I can gear negative working from home and not having people to talk to, especially when you're working and things are tough. All of us are in organizations that struggle. And at the end of the day, you're like, oh my God, we're never gonna make it. We're never gonna do anything. And checking myself and knowing that some of that's working from home and not what's actually going on. So just being in tune to that and making sure I'm then reaching out beyond this little cocoon where I could get all these negative thoughts to talk with other people, get me out of that space. So 2 things I'm trying to do.
Thank you.
So we're talking about how we're practicing, how we're taking care of ourselves. So removing myself from the work aspect, I'm okay with being a slouch. I'm okay with not coming up with this amazing idea. I'm okay with not using this time to create like this really innovative business that's going to catapult me to the next level. No, I watch Netflix. I lay around. Mm-hmm. I cry periodically. I overeat. Yeah, that's it. I'm okay with just absolutely, positively zoning out and coasting through this until we are in post-pandemic.
Mm-hmm. Amen.
I bought me a move around desk where I'm on video calls all day and they're watching me make my sandwiches, cook me a little breakfast. If you want me on a call, you're going to be cooking breakfast with me too that early in the morning.
I love it.
I've been learning, been buying lipstick from Black-owned businesses. Like I have, Brick House on my lips right now from The Lip, from Detroit. I've been Zoom calling my parents. My number one thing I need to stop doing, but I've been over buying baby stuff. And I'm like,
it's hard to stop.
I'm in baby heaven right now. And I look out the window, or look out my door and be like, okay, did I get a package today? I think them are the things that I've been doing. I've been cooking more, and I'm loving to be able to cook more into my house than I didn't used to do. And I'm excited to be at home more than I was.
First time parents buy all the stuff you want to buy.
Yeah, exactly.
Enjoy it. So next question, and we'll do this in reverse order. So LaSaia, we'll start with you, and then Channyn, and then Michael, and then Aisha. So let's look at what your organizations are doing now. So what organizationally have you been doing to address the needs of your clients or constituents during this pandemic?
Repeat that for me one more time.
What have you been doing as an organization to address the needs of your clients or constituents during this pandemic?
I think most organizations went everything online. So we put our support groups and our mutual aid groups online. But also what came out of the mutual aid groups is the food pantry and the trans relief fund that we're doing. The food pantry is going as strong as it was when it started. And also the trans relief fund is a continuous fundraiser. So we are continually fundraising, continues to push that out to make sure that someone gets something, that not nothing, right? And leading with trust for them to use the money as they see fit that they need. And the food pantry, as of right now, we've served over 3,000 people in the little amount of time that we've continued to serve. So I'm excited about them and excited for them to continue after the pandemic, that we have our own LGBT food pantry on the South Side that people can come to. So yeah, that's what we've been doing, and we've been going at it strong.
Channyn, how about Howard Brown?
So I think like everybody else, right, this moment has required us to have to be incredibly nimble, right? I think the pandemic hit us all really hard and fast, and we've had to make those adjustments in real time. Howard Brown Health, you know, as y'all know, is a health center that serves over 35,000 patients and has about over 500 employees. So we've had to rapidly shift our response to COVID-19. And a few of the ways that we've done that is we have set up community care stations in partnership with various locations throughout the city of Chicago, namely Task Force and Project Vita. Task Force is in the Austin community, and Project Vita is in Little Village. That has been such an amazing partnership. We've also set up COVID testing sites at our 63rd location in Inglewood and in 55th, on 55th Street in Hyde Park. Those are 2 locations, you know, amongst the others that we have as well. One of the other things that we're really excited about that has had such an amazing community reception has been the mobile unit testing headed by Dr. Maya Green. That has been amazing. I mean, we have just taken the show on the road, so to speak, and we are traveling and testing in historically underserved communities. We have tested 75 to 100 people a day during the 3 days a week that we are offering those testing services, which are Thursday through Saturday. One of the really unique things about that mobile testing is a lot of spaces are requiring that people who are interested in testing be symptomatic. We are not. You can walk up to the mobile unit and you can simply say, I wonder, do I actually have COVID-19? Come, let's find out, you know? So those are the ways that we have really been nimble in our rapid community response at Howard Brown Health.
I think for us at Chicago House, obviously the focus of what we do is housing. And in this time, we're really about sheltering at home. So our clients oftentimes are resistant to some of the kind of protocols that have been put into place. So a lot of prevention and education have been happening with our clients at Chicago House. Both our residential clients as well as our scattered site clients, trying to really convince clients and educate them to the importance of staying home. There's high vulnerability already, and we're trying to keep them as safe as we can. That's challenging. We have a lot of conversations. We have a lot of outreach with our case managers and conversation with our tenants and our residents across the city. But really, we do believe in the shelter in place. We believe that people are safer if they're not out and about, and trying to limit high-risk behaviors, both for people living with HIV and vulnerable to HIV, but also for those right now during this pandemic, really trying to keep people away from COVID-19 as much as we can. It's just going to immensely complicate their health and trying to do that. So that it's, at times that works, at times it's been a battle. You know, the minute we feel it ourselves, the minute you have to stay somewhere is when you really want to get out. And so we've really been working with clients to some of the importance of sheltering at home, and then providing the services, food cards, and making sure people have buying food for our residents, making sure there's food in all of our facilities is really essential to try to prevent as much of that moving around as possible with our clients right now.
So at AFC, it's been a combination of switching things over for employees and making sure that everyone can do as much work remotely as possible. And then also figuring out how to pivot for the folks that we're serving in the community. And because we have different departments that do different things, it looks differently in terms of how we continue to provide services in the pandemic. So for our policy and advocacy team, that has meant switching over to virtual advocacy, including our virtual advocacy day last week, which wasn't just a one-time, one-day opportunity to engage with elected officials. We still have that information available and you can still do those things. And if people want to know more about that, feel free to reach out. Outside of policy and advocacy, when we're talking about our teams that are more involved with direct service provision and connecting people to care, we've been switching over to virtual meetings with either existing or potential clients, and also making sure that we keep up with the policy changes that have kind of loosened some of the barriers to access that a lot of our clients have faced in the past. So for example, when it comes to housing, as Michael was just talking about, right now is a really difficult time for people to feel secure in the housing that they have, even if they have never experienced any kind of housing insecurity before. So making sure that we let people know what services are still available through the different, grants and programs that we've already had, how to get connected if you've never been connected before, how to make sure that all the paperwork is done in the safest way possible. Again, we're talking about communities that are at higher risk. And then also making sure that we are advocating alongside other organizations that we've already been working with. So that means making sure that we are pushing for higher SNAP allotments, access to more resources, making sure that we're backing the bills that are supporting any kind of stimulus package that really does serve the community that we're looking to. And I would also be remiss if I didn't mention that a lot of the other organizations that I work with outside of AFC are switching over to this virtual thing as well. So I'm on the board of Affinity Community Services. I'm on the Advisory Council for Pride Action Tank. I'm on the board of the Public Health Institute for Metropolitan Chicago. And all of these organizations have switched over to doing things remotely because they want to make sure that our communities are staying safe. What that means is having virtual office hours at Affinity, different events like that at Affinity, Pride Action Tank, working with other organizations and reaching out to try to figure out what we can do to be responsive to the pandemic and also be forward looking. And then at at Public Health Institute of Metropolitan Chicago, we're looking at having our Night of Noise Gala that the Illinois Safe Schools Alliance has often put on be switched over to virtual as well. So a lot of it is just switching things over to virtual. The difficulty in that, of course, is that we are missing the connection and contact that we were used to having, especially in advocacy work, especially when you're talking about communities that are often very close-knit and see each other as family more than just friends. But I think that we've all been nimble and trying to be as supportive as possible and provide care in a way that doesn't necessarily look the same as it would outside of a pandemic.
Yeah. Thank you all for the amazing work that's happening within these organizations. And I echo what you're saying, Aisha, about just, you did lose something being virtual, because it's kind of where we are right now. And the hope is that we can take what we're learning and, move it into the new world, whatever that's going to be. So Aisha, since we're on you, so a few weeks ago, we saw news reports about the disproportionate impact of COVID-19 on marginalized groups, particularly Black folks. And just recently, I have seen reports on just the growing numbers of Latinx folks who are also impacted by COVID. And I know intersectionality has been a huge area of focus of you in both your academic life, but also in your work life outside of academia. And so can you take a moment to just unpack intersectionality for folks, but also talk about how our analysis of COVID and I will say other forms of structural violence, including state violence, policing, community violence, all those things, what that looks like for people who have both Black and queer identities.
Yeah, sure. So when we're talking about these kinds of conversations around the disproportionate effects of COVID-19, this pandemic, and other oppressive form, like oppression and discrimination that's impacted these communities since before this pandemic started. what we're thinking about is the way that each individual is experiencing the different forms of oppression or discrimination. So we can look at it from the point of view of intersectionality, where we're talking about someone who's experiencing a particular type of discrimination based on like a combination of different attributes that are recognized by law as ways that you can be discriminated against. So for example, if you are a person of color, if you're a woman, if you are a queer person, those are different areas that you can usually address in some kind of policy or legal arena. But then you're also thinking about the ways that multiple jeopardy comes into play. So the way that oppression can kind of be layered on top of each other. They're two similar ideas and conversations, but they're not the same thing. And I think that the hard part is that oftentimes the conversation gets blurred around them, and people fight about the language all the time. And, I know that I love saying words mean things. But in this moment, I'm going to just like step away from all the theory and the concerns about separating those things and think about the way that this pandemic is just really elevating conversations that we've been having a lot, but that a lot of other people haven't been having as often. Like you mentioned, I think it was earlier this week, the Illinois Department of Public Health put out the numbers that stated that the Latinx community has now the highest positive testing rate for COVID-19. We also know that the numbers are still saying that Black people are have the highest mortality rate as a result of the pandemic. Those are two very separate statistics, but they're both showing that the most disparate impacts are happening to these two communities. And then, like you said, we can't divorce what's happening in the pandemic from the things that are happening outside that have already been weighing on these communities, right? So it's not just that the pandemic is hitting us in these very specific ways. It's also how Channyn was saying that there are certain neighborhoods in the city and across the state that have access to certain resources and some that don't. The same way that LaSaia and her organization are working to get food to places that are often in the middle of food deserts. So when we're talking about sheltering in place, and like Michael said, sheltering in place is something you can do when you have a place to shelter. And some people don't have that. So all of these things are working together and kind of making this pandemic a little more stifling than it would feel if we all had access to the same resources, if we all knew that we could call Instacart and get something delivered safely to us, if we all knew that we didn't necessarily have to go out of our homes, if we could work remotely. There are people who don't have that ability. And what we need to do when we're thinking about this is remember that that's still the case. Like I said this last night when we were, when the Chicago House Book Club was meeting, there are people who are out here marching and talking about getting out and going back to work. And it's not really that they're trying to go back to work. They're trying to make sure that the people who are providing them services are going back to work. They want to go get their hair cut. They want to be able to get their nails done. They want to be able to go to a certain restaurant. And it's really them fighting against feeling like they can't maintain the standard that they were used to outside of a pandemic. And it really shows a lack of empathy and understanding for other communities who aren't able to just kind of shutter in and feel like they can provide this cocoon around themselves of safety. So when we're looking at the ways that we can address this pandemic and think about it, we have to remember that it's not just about saying that, oh, now you can do these things remotely. Some people don't have a laptop or Wi-Fi to access it, or saying, oh, now we'll waive the fee for you to go get tested for COVID-19, but then they're not talking about the treatment that comes after that. It's thinking 2 and 3 steps ahead to make sure that the people who may not have a car to get to the free testing site, so you get a mobile unit like they did at Howard Brown, or you're saying that you need access to this food and you might not be able to get to it, but you can help pay for it. You can donate money to an organization like Brave Alliance and they'll still bring you food out. Like things like this can happen. There are ways for us to mutually aid each other and benefit in these ways, but you have to be willing to think past just the first things that come to mind. You have to really think through it. And I think that in these moments and in these conversations, you have to have all the people in the room who are being impacted by it, because there are certain things that you just can't think of, that you can't imagine because they haven't been a part of your reality. And a lot of that is not as easy when we're so far apart. It's not as, like we're not as able to make these connections, but it's something that we really have to do. Just this week, we've seen the deaths of unarmed Black people. And we know that this has been happening before the pandemic. One of the ones that has gotten a lot of traction happened before the shelter-in-place orders really went into effect, but there was a new video released about it. So thinking about the killings that have been happening and the ways that it still weighs on us, and we still have to be able to try to continue on facing this new pandemic with still addressing the other pandemics that were already existing. There's a lot. There are a lot of intersecting things that have to be addressed and considered. And we can't really do it effectively if we're not listening to the people who have the experiences that we don't.
I appreciate you bringing all of those things together, because I think a lot of times when we, even talk about the LGBTQ plus community, people have a certain lens that they look through, and they don't necessarily look at all the diversity within the LGBTQ plus community. And it's important to have all those different frames and that intersectionality frame in particular. So thank you for giving that little piece, a piece of a 101 on intersectionality. But I think it's always important to start these kinds of conversations with that type of frame as we go forward. So thank you for that. So the next question is for Michael. And, this is going back to some of the things that Aisha has pulled together. So, we hear a lot of comparisons between COVID-19 and the pandemic and the AIDS crisis, and particularly discussions around like timelines for drug treatments, promise of potential vaccines and those kinds of things, but also around stigma that people are facing based on their real or perceived identities, risky behavior, and more. And so as you look at these two public health crises, what are some of the lessons that can be taken from the AIDS crisis and applied to the COVID-19 pandemic? And where are there differences, just to be clear for folks?
Kim, I think you're right. There's a lot of points of comparison, and a lot of people are bringing it up. I think one of the things that I see as having great impact on the HIV crisis, especially in the 80s and 90s, and continuing to today, is really the moral overtones that were always put on behaviors and why people got HIV. And all of a sudden, it was easy to dismiss people. You did this, and that's why this is happening to you. And somehow that's not of a concern for me because you brought this on yourself. And I would have a great fear that we're starting to see some of that same behavior exhibiting around COVID-19, that you were warned, you were told, why did you do this? And now this is happening to you. I need to move on with my life. This is someone who wasn't doing what they were supposed to. So I think that moral overtone, which often comes with these type of crises, is very damaging. I think the AIDS crisis and HIV as it continues is also impacted by the issue of it impacting a minority group. Originally, gay men, and that continued it to expand, and today continuing to impact communities of color. And somehow there's an ability for us to dismiss things that are part of a small group. I think COVID-19 started as a bigger issue, but what's happening is, especially our population, our business owners that are all being impacted by this are now pushing to go back. Let's forget about any of the steps we're taking to prevent the spread. It's time for us to get back to what we need to get back to, making money, doing the things that we do, having the liberties, and all of these kind of protests, which really have nothing to do with health and protection. They have to do with people getting what they want. And my fear is that will begin to happen. It has happened to HIV. HIV is still around 35 years later, partly because it's mostly impacting minority communities, LGBTQ plus communities and communities of color. And somehow the focus on trying to solve that issue is faded. And as we see these numbers with COVID-19, the fear is that the same thing is going to start to happen. Even say we get a vaccine. So obviously the cure for HIV was around the corner in the early 90s. It's now 2020 and we don't have that. But say COVID-19 gets more attention, more funding, they come up with a vaccine. Who is that vaccine going to benefit? Is it going to benefit communities of color who are most impacted by COVID-19? Or is it going to benefit communities that are less impacted but have the resources and the political influence to make sure it takes care of them? So that continues to be a fear. It's a fear for for our organization that as all of this investment has gone out, somehow the support of HIV is going to diminish. It's not as strong as it should be now. If we lose funding for HIV, that's just going to exacerbate the problem in communities of color and minority communities that are highly impacted. So I think that kind of connection, first of all, not moralizing that it's somehow someone's behavior, they did something that brought on sickness for themselves. That's just ridiculous thinking. Someone who's sick is sick, and there is no connection to what they did that should determine how we serve them or care for them or give them the health benefits that they need. And secondly, not letting something just gravitate into minority community that we no longer have to pay much attention to it. And I think there is potential for that to reoccur with COVID-19, and hopefully it won't, but we already see it. It's been 2.5 months, and there are a whole group of people who are like, let's forget about it and move on. And unfortunately, we know which communities are going to be most impacted by that type of decision making. And hopefully we can learn from some of that so that COVID-19 is still not taking out people in communities of color and minority communities 35 years from now. That would just be devastating. That continues to happen for HIV. I don't want to see it happen again for COVID-19.
Thank you, Michael. Yeah, this is definitely an opportunity to apply some real lessons learned and do better as a society. We can do so much better. I want to remind folks, and I see some folks are doing that you can enter questions into the Q&A box, and Tyler is going to go through those questions and read a few of them from time to time. So Channyn, as Aisha mentioned, those of us who can shelter in place are doing that, but in large part to prevent overtaxing what many have finally come to understand as our very fragile healthcare system. And we see healthcare providers needing to face this crisis with both creativity and nimbleness, as you mentioned before. So tell us more about how the pandemic has affected Howard Brown, and how it provides services, and what are some of the ways that Howard Brown has had to be creative during this historic moment.
Yeah, so again, we're repeating that word a lot, nimble, but that's really what this time honestly just requires us all to be at the moment. It's required us all to be rapid responders in varying, degrees. I mentioned earlier that, Howard Brown Health is a multi-site organization with over 35,000 patients, along with 500 employees, right? And with that being said, the first priority is safety, making sure that we are in alignment with, state and city guidelines in as it relates to the response to shelter in place and COVID-19. So I'll start with our workforce that is at home, sheltering in place. They have done such an amazing job at securing a lot of the virtual education and support for not only community, but also for our patient population base. Being able to shift to telehealth to make sure that those appointments are still actually happening, making sure that they're still being seen. Also to, again, with COVID-19 being such a new thing, there's a lack of knowledge. No one's educated on this. I mean, even the professionals right now are getting new information day by day. So one of the things that we're really striving to do is make sure as we get that information that we're disseminating it to community in ways that is tangible and understanding for them as well. So that's some of the ways that we're doing that. I mentioned earlier that we're doing our mobile care units that we're deploying throughout the city, particularly in more vulnerable communities or communities that have been historically underserved. That right there has had a huge community reception due to the fact that we've seen on TV that in the earlier moments of COVID-19, it's funny I'm saying earlier moments, and honestly like 3 months in, but during the earlier moments of COVID-19, it seemed like you had to have like a great deal of celebrity or quite a bit of income in order to actually have access to testing. So one of the great things about what Howard Brown is doing with other spaces as well is being able to provide that type of access to spaces who otherwise wouldn't have, access to testing. You spoke about the fragileness of the healthcare system. That's the problem right there, right? The healthcare system should not be fragile. The healthcare system should be something that is stable. It should be something that is prioritized. There shouldn't be something like this that leaves the healthcare system in such a tenuous state. That's the thing. And also, too, we have to have the larger conversation about what does it look like to have healthcare benefits tied to your employment. That's the biggest issue right there. Is as long as we continue to have to lean on employment for healthcare, we're going to continue to see ourselves in this same battle when the next thing comes along, So yeah, that's what we're doing in terms of creativity. Our staff, we're just so proud of them. They have absolutely been healthcare heroes, whether that looks like frontline staff or whether that looks like staff who are providing support to those individuals that are providing that patient care work. Again, we're really proud, and we just couldn't be more pleased with the responses that we've had in terms of COVID-19.
Yeah, it's amazing to see the staff of all these organizations just really jump into the gap, right, in various ways. And that fragility of the system is just terrifying, actually. And when we see it straining in these ways, it just really speaks to where the priorities have not been in this country. And again, my phrase is, we can do better. We have to do better. LaSaia, before the sort of federal and local lawmakers figured out what was needed for people and what to do, there were folks on the ground, such as Brave Space Alliance, who began almost immediately to take care of people's basic needs. And you've talked about your mutual aid work and how this work has grown through this pandemic. And it talk about stepping into the gap. That's what a lot of these organizations that are doing the mutual aid stuff are sort of forced to do, right? Take on the role that a government should take on. So as you continue to do that, and again, I go back to being so nimble, what are some of the challenges and solutions you're thinking about as we move forward? We're not there yet, but get on the other side of this, and how to sustain these efforts that have shown themselves to be needed in the transgender, gender nonconforming community in particular, more broadly as well, but specifically for that group of people. What are you thinking about in terms of how you sustain this effort?
I think we've proven what we can do in this moment, and we've proven everyone wrong in this moment of how they have failed us and how we can step up and actually do the work that we need to do for ourselves, and how we have automatically knew what we automatically needed. Because we have always been first responders, and a trans person's automatic mind of a trans person is, how am I going to be safe? How am I going to get my bills paid? What do I have to do 20 steps ahead? Because trans people are already 20 steps ahead, because we have to worry about, and especially if a trans person is just starting their transition, right? And I want to say that is multitudes of levels of violence a trans person receives when they're just starting their transition. what they see their transition supposed to be, right? So it's an understanding of, we knew something like this was always going to happen, but also we live this life of in extreme need daily. Mm-hmm. So it's a point of like, how do I make sure my community is safe, but also bring them to the full abundance of resources that we can actually give them. So we tapped into people power. Mm-hmm. That's all we know. People power and my neighbor. People power and my neighbor. I need to say that because if my neighbor isn't okay, I'm not going to be okay. Mm-hmm. And that's how we have continues to move. It's like asking our volunteers, "Are you okay?" Asking our volunteers what you can do and what you can't do. Asking what can they do to help us push the narrative of BSA forward. And we continue to do that. I think it's important in this particular climate, pandemic, and crisis, and political structure that we're dealing with right now. There are multitudes of different levels of showing how messed up they've been before the pandemic, and how messed up they are during a pandemic. I continue to push back the narrative. If we had the funding like we had, if we had the funding like we're supposed to have, trust me, we will be okay. And if they allocated the funding towards Black and LGBT people like they're supposed to be allocated, our communities wouldn't be as and as hurt as it is now. And I can simplify that. I was on a call the other day around funding Black LGBT or Black orgs around HIV itself, and how it's only allocated $1 million in that fund, and only 10 orgs throughout the state of Illinois gets that, and it's only $100,000 per org. And how important it is to actually level up that funds from the states, to actually not only give them survival funds, but thriving funds to push their work further than it's supposed to. And also, why is it only $100,000 given, or only $1 million given to Black orgs that are actually talking about HIV throughout the Illinois state, when other organizations are able to tap into different type of resources and funding through the state of Illinois? So it's a continuous, okay, I have to write these notes down and prove to you how messed up you were, and also how messed up you are now, and actually allocating equity across the board. So yeah, it's a continuous I told you so mode. I don't like it, but it's a continuous I told you so. This is how yours messed up. It's like BDSM. What can I do to make sure that we get these funds at the end of the day? Because it's how important it is when we're only 14%. Black people are only 14% of Illinois, but we're also the heaviest hit. So that's a big problem.
I did not think BDSM would come into this conversation, but thank you for that so much. And thank you for all the other wisdom as well. And that notion of, if my neighbor isn't okay, I'm not okay, is, that's the crux of it, right? And that's really, how we should be making our decisions, right? We need to make sure that everybody is okay. Tyler, do you want to break in for some questions from the audience?
Yeah, absolutely. So the first one is, what ideologies and beliefs contributed to the lack of official response in HIV/AIDS back in the 80s and 90s, and what lessons can we apply to COVID-19 today?
I'll jump in. I might be an older panelist here. I think at the beginning, I think there's a major difference between HIV and COVID-19. HIV was completely ignored. There is an attempt by this administration to play down the impact of COVID-19, but really in the early 80s, HIV and AIDS they tried to ignore it, they tried never to mention the word. There was a radical just ignorance of the issue, and it was just stuck in the corner. This is something for this group of people to deal with. They brought it on themselves. They're to blame. We shouldn't have anything to do with it. Luckily, that same level of ignorance is not at play. People are forced by science for one reason. COVID-19 did not start. It started among rich people, and rich people travel. And rich people traveled to every country in the world and brought COVID-19 to every country in the world. The trouble is the inequities of health in those countries means that it quickly went from rich people to communities who are more vulnerable. And I think that is one of the ideological issues that we have to deal with. How do we focus on this disparities that exist in healthcare so that when something happens like HIV, like COVID-19, it isn't ignored until it impacts the wealthier community, communities of influence. How do we keep that from happening? Why don't we address COVID-19 and HIV the same way we would no matter who it impacts? That there isn't an inequity of what the response is. I think that's a huge issue when it's related to health. I think that's been shown when you put HIV and COVID-19 together. HIV was ignored for years and is around 35 years later and still is an epidemic. That's crazy, 35 years later. Yeah. 19, because it impacted more people, is going to get more attention. But there's still a major problem inherent in both of those.
I think another thing that we can do is learn from what we saw during the startup and as we are trying to end the HIV epidemic. So we've seen the way that, you know, the face of the HIV epidemic became a cis white gay man, right? And we see that a lot of the resources that have been allocated have gone to people who fit that demographic. What we can do now with this COVID-19 pandemic and what we can try to turn away from what's happening already is provide the resources in an equitable fashion, like LaSaia said. And I think that the thing is that people like the word equity because it sounds like equality, but when they think about it and they see it play out, they're a little bit more resistant to it. Yeah. Because what that means is that if we have an allocation of $5 million that are supposed to go to communities to respond to COVID-19, 4.9 million of those dollars need to go to communities of color immediately without even thinking about it. And I don't think that people are ready to see that happen in action. I know that people like to hear the statistics, they can empathize on that level, but when it means that it will actually look like their resources being distributed in a different way and how it would impact them, there's a little bit more resistance. And we can point to where the numbers are right now to show that when things aren't done equitably, it will produce these disparities and keep them going. When you look at the numbers here in the city of Chicago and across the state of Illinois, about 50% of people living with HIV right now are Black. That's it, like diagnosed or undiagnosed. Those numbers are shown across the board. For that to be the case, but then when you think about, okay, queer resources, when you think about, okay, resources for people living with HIV, are you immediately thinking of a Black person? Are you thinking of a Black trans woman? Are you thinking of a cis Black woman? Are you thinking of women at all in general? Like, these are the things that we're forced to consider. And because we have the evidence, we have the facts right at our fingertips about what the HIV epidemic still looks like 30, 40 years later, we know what this COVID-19 pandemic and the ripple effects of it can look like 30 or 40 years later. We talk about the fact that vaccines have kind of eradicated a lot of diseases, but that's not true. They still exist on this planet. It's just that we have built up a herd immunity to them. But in areas that don't have access to those vaccines the same way that we do right now in the United States, it's still there. It's still happening. I was just in conversation with the Chicago House Book Club last night. We're talking about the fact that tuberculosis still exists in communities and in a lot of Black communities in the United States, but it's something that we've had a vaccine for years now. we might end up with the COVID-19 vaccine before 2021, but what will that look like? How is the vaccine distributed? Like was just said earlier, how is it distributed? Who is it tested on? What communities have access to it? How much will it cost? Insurance companies are already trying to think of ways to skirt around actually covering treatment for COVID-19, or thinking about inserting questions in their questionnaires about, have you been diagnosed? Has someone in your family been diagnosed with COVID-19, to see if they can squeeze it in as a pre-existing condition. These are things that are happening already that we know we can address. And then when you look outside of the healthcare sector and think about the criminalization of people, we see people living with HIV being criminalized across the country and around the world. That is something that we don't want to see happen with COVID-19, but there are already moves being made that can you can see it happening already, where people are, either being told that a municipality may institute a policy where their COVID-19 status will be shared with first responders before they respond to an emergency at their home. If you're coming to provide me some kind of care, if you're coming to put a fire out in my apartment, you don't need to know if I've tested positive for COVID-19. You should treat everyone the same. You should assume all of the risks regardless of who you're going to see. And if you find out that I do have COVID-19 or someone in my family does, you shouldn't treat me any differently. We've seen from every level of government that the statistics show that you should not be treating people differently based on a diagnosis of COVID-19. And the same thing is for people with HIV. So I think that what we can do and learn from the HIV epidemic is how to prevent these ongoing disparities and the ongoing discrimination that we see within communities and across different communities when we're talking about addressing an issue.
I also wanted to jump in really quickly because Michael, you really highlighted the truth of the matter is that when we attach things to certain groups or certain subsets of populations, we automatically view them as expendable because it doesn't directly affect me. One of the things that COVID-19 immediately brought up is the fact that we have a real ageism problem in this country. Because when we first initially thought, oh, this really affects elderly people who have weakened immune systems, we said, okay, well, it doesn't have a lot to do with me. And it just goes to show how we regard our elders. So now all of a sudden we're seeing that this actually does affect the young, actually the very young. Now there's more of a urgency amongst younger populations to maybe shelter in place, to maybe think about why we might want to give this more attention than we initially thought, right? I think that if the spring breakers in Florida knew what they knew right now, I don't know if they would have been as quick to respond the way they did. Again, I kind of still want to put I want to shift the onus of responsibility back to systems. I know that we all, as LaSaia said, that we all need to make sure that we're caring for our neighbor, but sheltering in place should not be what holds the healthcare system together. No, that's the federal government's responsibility. That is our state and local government's responsibility. We should not put the onus of the healthcare system onto individuals who have to survive and navigate society on a daily basis. That is not fair. And I don't want to take up too much time because I know we have other questions, but I'm just going to leave it right there.
I think I want to jump into that too. Okay. I think also the conversation around universal health care needs to be said, and universal income needs to be said too, because a lot of this would not have happened, and a lot of us would have a lot of people would have stayed sheltered in place if they knew that they had money coming in, and if they knew they had health care coming in, and they didn't have them particular problems. Thank you, Jack, for placing individualism is dead, and it's imperative to understand when I talk about individualism, is the understanding before this COVID-19, everyone was worried about themselves, and everyone was worried about, what am I going to do? And if you're homeless, that's your fault that you're homeless. If you're poor, that's your fault that you're poor. If you don't have enough income, you should go to school. But also going to school nowadays, an understanding that you have education really don't get you the job that you want, because you're actually fighting for that job for $20,000 as other people for that position, right? So we need to understand that, yes, individualism is dead. So, and we have to, yes, I understand what you're saying, Channyn, but we also have to understand that if we do not take care of the people that is around us, we can't really take care of ourselves the way we want to. And especially when we're talking about COVID, because as we learn particular things, COVID lingers in the air. So if my neighbor walks outside and I follow right behind my neighbor and did not know that they had COVID or not, COVID-19 or not, now I have it. Now, not only do I have it, my kids and my partner and my dog and my cat. Now, if you are more privileged to your dog and cat than your kids, I understand. So I have to include them in the conversations now. That your dog and cats. As we've seen society today, dogs and cats get treated better in certain spaces than Black people. I have to bring that in the conversation too. So yes, your dogs and cats can get COVID, and then also your kids from your dogs and cats, and vice versa. So the understanding, like, yes, we have to take care of ourselves, but also, yes, we have to have some sense of notion to scream out the door, neighbor, are you okay? Do you need some bread? I know people, let me slip you this note. And I learned that about my neighborhood that I'm living in now, is when something pops off on the street, everyone pokes their head out. I learned that yesterday, and everyone was screaming, are you okay? Are you okay? And we were back in the house. So, and it's a wonderful feeling that we're starting to realize that we have to take care of each other, because we know the state has never taken care of us. So it's that realization that right now, and hopefully moving forward after the pandemic, that we know individualism is dead because we're so connected.
Thank you all for all of this wisdom, and thank you, Channyn, in particular, for bringing in older adults into this conversation. This time has flown by. We have like 3 minutes left, and I never like to end anything on a super challenging note. I like to end with joy. So I'm going to ask each of you what brings you joy in this moment. This is a hard time, and I think we need to pass on the joy as well as all the recommendations about policy changes and acknowledgement that this is a really jacked up country that we're living in when it comes to taking care of people. So we'll go in the original order from the beginning. So I think that was Aisha, Michael, Channyn, and LaSaia. What brings you joy, Aisha?
The things that have brought me joy most recently have been my purchase of gel nail polish and a UV lamp to do my own nails because I'm staying in the house.
Can you show them? Can you show them?
Oh no, they're not done right now, y'all.
Okay.
I had to recently take off the acrylic completely, so you know, we have a moratorium on my nails at the moment. But I've also been kind of stocking up on fun kitchen gadgets that I didn't think that I would ever get because I couldn't really justify it. But now that I'm in the house all the time, I can use it. So I now have a milk frother to make all of the fanciest lattes. So post-pandemic, I might not be spending as much money at Starbucks. We'll see how that goes.
I'm going to say music. Obviously, when we're running around, I don't know what happened to me. I got old, I think. I listened to news radio in the car. It's scary.
I do that.
Now that I'm at home more, I find I'm gravitating to music. And particularly, I'm a big show queen, so I love my theater music, which has been a great joy. And I have to say, I did have to sneak into Jewel yesterday, and they're selling Fannie Mae 2 for 1. Because no one bought it for the Easter celebration. So chocolate is my dream. So I'm eating way too much chocolate here at home.
Michael, I have to echo you because little do folks know I'm a big show queen too. I oh my God, I bust out singing like Lacajo Falls and I Am That I Am like all the time. I'm like a big queen. What brings me joy? Most recently, the fact that I can walk through my house and say, this is my house. My house. I don't have to worry about anybody disrupting my pillows and disregarding their arrangement. I take joy in paying my bills. I take joy in this refreshing but unnerving independence that I have had as of late. I take joy in being able to take unlabored deep breaths, which is something that is that we're all more acutely aware of nowadays, you know? And yeah, being able to lay around and watch Hollywood and Netflix series, binge watching, you know, those are things that I really take a lot of joy in right now. So yeah. Oh, you mentioned contact tracing. Howard Brown is doing contract tracing. Talk to me offline if you'd like to hear more about that.
Okay.
I've just been sitting and realizing for myself about like this moment of like really centering myself again and not always being in the hectic moment. Watching my partner do farming things in the backyard. Growing herbs myself in the front yard to keep my stuff separate from his stuff because his stuff goes to other people. I want to keep my stuff. Just waiting. I think the biggest joy right now is waiting to meet a small person that will be welcoming in my house. And that's my biggest moment of like, I'm able to pass things down that I thought I would never be able to do.
Wow. That's a beautiful note to end on. You all bring me a great deal of joy. Thank you for the amazing work that you all do and through your organizations and as individuals. And thank you, Chicago House, for pulling this amazing program together. It's one of several programs. I know there's another one coming up May 15th, so you'll begin to see information on about that. So I want to thank you again, Aisha, Michael, Channyn, and LaSaia for being here, and thank you, Chicago House. And all of you out there who we can't see, thank you for tuning in. We really appreciate you, and so sorry we couldn't get to all of your questions. But thank you. Everybody have a great day and a great weekend, whatever that means these days, because we're in the same place.
Thanks, Missy. Missy, thank you for your work.
Thank you all.
Missy,
have a good day, y'all.
Thank you, Missy. Thank you,
Missy.
All right,
y'all have
everybody.
a good day.
You too.
Thanks, everybody.
Bye-bye.
Bye-bye.
Bye.